Hi, I'm Mayor Liz Lempert with today's Coronavirus Daily Update. Today, we're going to hear from our health officer, Jeff Grosser.
What is the safest way to self-isolate one person within a larger household?
If you can, identifying a separate space for a sick person, a space where they can access the restroom without traveling through common spaces, would be best. Those who are caring for loved ones who are sick at home should wash their hands frequently, avoid close contact as much as possible, and have the sick individual wear a surgical or procedural mask to prevent droplets spreading through the air.
In households that are not able to accommodate all of these suggestions, what else can be done to limit transmission at home?
If you're not a caregiver, maintaining 6 feet of distance and washing your hands frequently and not touching your mouth, nose, eyes, or any part of your face are the main steps, along with cleaning surfaces often. If you are a caregiver, it's certainly tougher. You should wear a mask if possible and follow the other guidelines of hand washing and cleaning clothes and surfaces frequently.
How can parents and other caregivers help children and dependents who are unable to follow the recommended advice, like frequent hand washing or touching their face, particularly if they need to be self-isolated?
This is the most difficult situation. It's very hard to stay away from kids, especially when they're ill and need care and comfort. If possible, main caregivers should be those who are not at a higher risk for serious complications if they develop COVID-19, meaning those not over the age of 60 or with underlying health conditions. These include heart, lung, or kidney diseases, autoimmune conditions, or diabetes. Other than that, it's important to take the normal precautions in terms of hand washing and cleaning.
How much can caregivers rely on childcare alternatives, relatives, neighbors, babysitters, in this moment?
In general, it's important to keep the circle of care as small as possible. At the moment, not exposing yourself to many additional people is the best way to avoid infection with the novel coronavirus that causes COVID-19. Healthcare workers, people with critical jobs, and hourly employees who have to work in essential businesses will need to rely on childcare providers. In those situations, you should use someone that you know and trust, and who is reliable in taking the social distancing rules seriously.
What supplies should be on hand for both self-quarantine and self-isolation?
For self-quarantine, you should have your basic supplies like food and liquids and 30 days of any medications that you take. If you should develop symptoms, and even in anticipation of becoming sick, you should have supplies like Gatorade or other types of liquids to help maintain hydration if you develop a fever. Certainly, various types of cough medicines and fever-reducing agents should be on hand. If you should develop symptoms, and even in anticipation of being sick, you should have supplies like Gatorade or other types of liquids to help maintain hydration if you develop a fever. Certainly, various types of cough medicines and fever-reducing agents will help an ill person be more comfortable and get needed rest. In public health, we know that contagious diseases require breaking something called the chain of transmission. The chain of transmission is how an infectious agent can get into a host or a person and then travel from person to person that inevitably will become an outbreak. In this current pandemic, breaking the chain of transmission obviously has to be done on a very large scale. The social distancing measures that we're putting into place, the self-quarantine, the self-isolation that are currently going to work based upon the scale of this are the only tools in the current outbreak. As a result, each one of us is currently taking a role in ending this pandemic.
Thanks, Jeff. I want to thank you, the members of the Board of Health, and the Health Department for all that you're doing to keep our community safe during this crisis. Remember, we are all in this together.